Here at the CHEST 2014 conference in Austin, Texas, there were a couple of major studies regarding PAH, and who better to discuss those with us than Dr. Val McLaughlin. Thanks for being here.
Thanks, Tom.
Let's talk about the Ambition study first and the implications from that.
So the Ambition study is a very unique study, Tom. It's unlike anything we've ever done in pulmonary arterial hypertension before. It's testing a treatment strategy, really more as opposed to a new drug. So the strategy is whether or not we should get very aggressive with dual upfront combination therapy versus use just one treatment for PAH. And using one treatment and sequentially adding is how we do things now, but many patients end up on dual therapy. So the Ambition study randomized patients, and in the primary analysis set there were about 500 patients, so a big study. They randomized these patients in a 2-to-1-to-1 fashion, so for every 4 patients, 2 received upfront combination therapy with Tadalafil and Ambrisentan. 1 received Ambrisentan monotherapy and then Tadalafil placebo, and 1 received Tadalafil monotherapy and Ambrisentan placebo. So those patients were followed sequentially for a relatively novel endpoint, this time to clinical failure, which includes many of the things that we think of as worsening, so death, hospitalization, that sort of thing, but also it had a more aggressive approach. We want to see patients achieve goals. So if a patient had a reduction in their hall walk and was still functional class 3 for 6 months, that counted as a time to clinical failure endpoint. Now, the results of this trial have been previously presented at ERS, and overall the trial was markedly positive. There was a 50% risk reduction in the primary endpoint with combination therapy versus pooled monotherapy. What was presented here at CHEST by Lou Rubin was the subgroup analysis. So there were some pre-specified subgroups, so age, gender, functional class, disease etiology, geographic distribution. And when you look at the subgroup analysis, every single subgroup had a treatment effect consistent with the primary analysis set. It was a very, very impressive study. So one thing that we have learned from this study is that, gosh, maybe it is better to be even more aggressive than we are with our treatment. Maybe starting naive patients, newly diagnosed patients, on oral therapy, on both oral therapies out of the gate, is better than starting one and waiting to see and then starting the other. It was a very impressive study result.
What can you summarize that you've taken from the COMPASS study?
So COMPASS 2 was also presented here, and COMPASS 2 is a study that's been going on for a very long time. It was actually the very first endpoint-driven trial that was started in pulmonary hypertension, and it randomized over 300 patients who were already taking Sildenafil to Bosentan or placebo. And the overall results of COMPASS 2 were neutral. It did not achieve the primary endpoint of morbidity and mortality. There was a 17% risk reduction, not statistically significant. And of course that's disappointing because that's a combination that's commonly used, but I view COMPASS 2 as an opportunity to learn about clinical trial design. It was the first ever M&M type of trial that we did, and we learned a lot. There was a high dropout rate. These are investigators and patients that weren't used to doing these types of trials, and we got better at patient retention as time went on, but it was a problem, particularly at the beginning. It was a real world trial, and so there might be some patients in the COMPASS 2 trial that perhaps had some risk factors for diastolic dysfunction. Perhaps they weren't the typical PAH population, and we learned from that. In fact, there were some subsequent trials, such as Ambition, that got tighter with their entry criteria based on the COMPASS 2 trial. But we used a novel endpoint that included a patient global self-assessment, and that hadn't been validated, so perhaps that wasn't the best choice. And it was a difficult trial to enroll over time, and so we changed some statistical analysis to make it more feasible, and that perhaps contributed too. So as the PAH community moves to these bigger M&M type of trials, even though COMPASS 2 was negative in the primary endpoint, I think we learned a lot about how to conduct such trials in the future from that as a first example.
It's a great approach to it. It's the beauty and the reality of clinical research, hence the term trial.
Yeah. Yeah.
Very good. Thank you. Thanks for sharing some time with us. We appreciate it.
Oh,
as
my
always.
pleasure. Thanks for having me.